one intelligence, that is heart attack in winter season. Why the heart attack increases in winter season? So in this topic, you will discuss what are the causes, what are the factors that increases heart attack in winter season, and most importantly, how can you prevent it? As you know, that winter season is a season of festival and fun activities, and we also know the winter season is associated with increased incidence of flu and common cold, but we most of us don't know the winter season associated with increased heart attack. Okay, so as per if you go the incidence wise, about 30% increasing heart attack occurs in winter season as compared to summer season, and about there is a 1/5 increasing incidence of cardiac arrest, okay, in winter season as compared to summer, and more of is the severity of heart attack in winter season is more than that of summer season. So as you know, with just heart attack, why it occurs? Heart attack basically, the heart also is a pumping organ. It pumps blood every minute minimum 60, every hours in a day, and every days in a week. So heart pumps about 5 liters of blood in a minute. Okay, so it pumps, it gives blood to each and every organ of our body. Just heart, just imagine this is our heart, just like fish structure. So heart is also gets blood supply by coronary. It supplies also to itself also. So it is called coronary arteries. When you get heart attack, when the blood flow decreases, when there is a block in one of the coronary arteries, one of the coronary arteries means coronary blood vessels. There are 3 blood, as you know, the left side, the heart is occurs left side, the left heart is also left side, 2 vessels are there, right 1 vessel. When there is a block, when the blood will not flow, so there occurs the distal part of the blood vessel will not get blood supply, that is called heart attack. Okay, so heart attack, you know, heart attack is still, it is a major cause of death in worldwide, including India, and more of this winter season, the heart attack increases. It is a 30% increase in heart rate as compared to summer season. So what are the factors why the heart attack increases in winter season? As you know, the most important factor is that is cold weather. So it is a physiological change. When there is a cold, so what will happen? The body outside temperature will come down 20-30 degrees Celsius, but body has to maintain the temperature 37 degrees Celsius in order to perform the normal physiological function. So what the blood vessel, what the body will do? It is a physiological response. It is a normal response. What will do? It causes vasoconstriction. Vasoconstriction means the blood vessel will decrease size. So the blood flow from the inner part of the body to skin will decrease. So that whatever this temperature there, body will try to maintain it, and the enzyme process, all the digestion process goes smoothly. So there occurs vasoconstriction, that is vasospasm. It is a normal response. So what will happen? When the blood vessel size will increase, the blood flow decreases. So in normal there will no problem. Those are having heart problems, the blood vessel problem, it will further increase will decrease the blood vessel size. So if there is a block, it will get total block, because blood vessel will constriction along with the coronary, along with the heart blood vessel, that is coronary arteries. So when there is vasospasm, if there is a block in coronary, it will get more block. Sometimes it will lead to heart attack. Another is when there is vasoconstriction, blood spasm, the blood pressure will increase. Okay, the heart rate will increase. So what will happen? The heart has to pump more, 2 times more to pump blood. Averagely, heart is in winter season, heart has to pump 2 times more. Okay, as compared to summer season. So the load on the heart will increase, and the blood flow decrease. That exposed to heart attack. And another factor is normally blood in a fluid state. Blood is smoothly drawn. there is a factor called platelet factor. So it will be, it keeps the blood in smooth state, in the smooth state, flowing state. What will happen in winter? The blood, the platelets become adhesive to each other. So chance of clot formation will increase, and the coagulants, the normal clotting factors, the fibrogen, the clotting factors, they will increase. Okay, so the clotting chances in winter is more than that of summer. Okay, and there is a hormonal changes, because there is a seasonal changes hormone. The hormones like adrenaline, vasopressin, the hormones that causes blood vessel spasm, they will increase. And another is that when there is a plaque, suppose inside the blood vessel there is plaque, the rupture of plaque chances are more in winter season. So these are the changes. Those are having this is a normal response. Those are not having any block, so they will adjust. Those are having some mild block or moderate block, so the blood vessel size will decrease, the platelet aggregation will increase, so that will lead to heart attacks. Okay, then another is your as you know, compared to summer, the winter season, the day duration decreases. Okay, so which people's their tendency to have less physical activities. So less physical activities means less metabolic demand, less consumption of energy. So the heart attack will increase. Another chance is, it is called holiday that is called holiday diet fasting, holiday feasting, not fasting, holiday feasting. So all the celebration, all the festivals, they come in the winter season. So people's tendency to have more foods, and because of the party, they tend to have more use alcohol and cigarette smoking, the increases. So the physical inactivity and increase in diet. Okay, that will increase the weight gain. And those are having diabetes, they will still come and they thought, because of festival I have taken some sugars, so diabetes will be uncontrolled, BP will increase. Okay, physical inactivity, that leading to all the risk factor of heart attacks, that increases in winter. So that lead to increase heart attack incidence in winter season. Another is your stress. As you have seen, there is a sufficient evidence that the winter season, the those are having this depressions are more common, because of the hormones, the melatonin, serotonin, they will decrease in this winter season. So people are more like to have stress, anxiety, loneliness, they are more common in winter season. There is a seasonal variation of the symptoms, so that will be exposed to heart attacks again. Another thing is the daylight. Okay, there is a decrease in daylight. So that will, what will happen if there is a decrease in daylight? You know, there is vitamin D deficiency. People's winter season, they are more likely to have vitamin D deficiency. So there is sufficient evidence. Those are having cardiovascular diseases, they are more likely to have less vitamin D in their blood. Okay. Another thing is, in winter season, the common respiratory infection, cold, all are increased. You know, this is common cold. You are more likely to have common cold and this flu-like symptoms. What will happen in common cold or flu-like symptoms? That you have the inflammatory state, the blood coagulation factor will increase, the CRP all will increase. They will expose the stress, they will be exposed to heart attacks. Another thing is, in winter season, most of the year the air pollution will increase also. The lot of factors is there. Along with lungs diseases, the heart diseases increases to air pollution. So the heart attack risk factors, your less sunlight, exposed to cold, less activity, more diet, okay, then increase alcohol and cigarette consumption, and more of stress, depression. The winter season, they are increasing. They are increasing. So that's people's more likely. Those are having this mild problem, mild heart attack, especially elder group peoples, they are more prone for this heart attack symptoms. Okay. So what should you do? How can you prevent these heart attacks in the winter season? The first foremost is, you have to avoid cold, unnecessary. You avoid cold, sudden export to cold. So before going to cold, means outside, you should have sufficient means sufficient clothes. Okay, so you should keep the body warm, so that there will be no vasoconstriction, because already outside is warm, so there will be no vasoconstriction, the platelet aggregate, all the things will decrease. Okay, especially the elderly, those are having heart problems, they should take proper precaution, and you should avoid unnecessary travel in night also. Okay, another thing is the, as you know, the diet and exercise. Okay, you have to do regular exercise without fail, because the winter season the metabolic rate decreases, so you have to do regular exercise. And exercise means you should, before exercise you should have warm up. Okay, it's not that suddenly you will run, there should be warm up for 10 minutes. You make the body to warm, then you will do exercise all the time. You know, the exercise is the type protocol, 30 minutes in a day and 5 days in a week. And those are having exercise previously, they try to increase the exercise activity. Okay, and diet means avoid this cholesterol diet. The party is not a problem, but before going to party you should decide what to take and what to not take. Okay, so you should take freshly leaf vegetables, avoid this artificial food, carbohydrate diets, and these store foods. If you are going to party, take proper precaution, and no smoking policy should be there, because it's the partying entertainment should not cost, it should not come in cost of your health. Okay, so added alcohol, if you are taking alcohol, you should decrease the alcohol amount to 2 times in a week. Okay, and then another thing is sunlight. Let your body to at least you expose your body to sunlight for at least 5 to 10 minutes in a day, so that the vitamin D synthesis will increase, and the stress, sunlight sometimes it is taken as it is a stress booster. Okay, so it will increase your mood, it is increase your activities. Okay, that's why it will decrease your stress. These are things you have to taken care of. And lastly, the one more thing is this viral infection. Okay, if you are having viral infection, if you are having chest pain, and if you are diabetes, you should control this all the things. And if you are still having some problem, you should visit a doctor, and you should do regular health checkup. It's not that always the viral symptoms, sometimes breathlessness may mimic with the heart attacks also, heart failure, all the symptoms. Okay, if you are having 1 to 2 days breathlessness, chest pain, visit to a doctor, do a ECG, echo, all the tests. Okay, so lastly, you should in the winter season is a season of festival and your fun activities. You should take care of your heart, so that and take care of your diet, exercise, and issue a happy healthy heart. Thank you. Okay, and I got question. Okay, how does cold weather impact blood vessel, blood pressure, and making winter heart more severe? Okay, as I have discussed, cold weather, what happens? Outside is cold. Suppose your body temperature is 37 degrees Celsius. Why body temperature 37 degrees is required? Because for all the process, digestion, the respiration, the enzyme formation, it requires a normal temperature. It means it is requires a fixed temperature, 37 degrees Celsius. Okay. So outside if it is 20 degrees Celsius, what will happen? The body will lose your heat, the heat transport to the environment. What will do? Body try to conserve it. So how can you conserve it? One of the function is will cause vasospasm. Vasospasm is there is a decreased blood to the skin. Okay, blood flow to skin. So it is a physiological response. It is happens to everybody. Okay, winter. What if those are having these heart problems, some mild attack, diabetes, hypertension, old heart problem, it will decreases for the blood vessel size. They are more prone for heart attacks. So those are mostly elderly persons. Those are having these heart problems. They should wear a sufficient protective clothing before going for cold. Okay, and blood pressure it will increase also. So blood pressure tablets, all the things should be, you should be double precaution, take double precaution in winter. Okay. Does age play a role in how our bodies respond to cold? Does it increase the risk of severe heart attack, especially older adults during winter? Yes, as I told, this as compared to young adults, the adaptive changes towards weather, they are less in older adults. Okay, means they are more prone to have more vasospasm, more platelet aggressibility, more clot formation, and they are more prone for also this temperature cold related problem also. So the heart attacks, although it increases in all age groups, the older people are there more likely to have these heart attacks, okay, as compared to younger. Then third question is, somebody asked interesting, what lifestyle changes like diet, exercise can be adapted to low risks for severe heart attack in winter? As a 12, it is as a advice for 12 months in a year, but inter season you have to take more of fresh vegetables, okay, avoid smoking and tobacco, and you have to take less sugar diets, less carbohydrate, less artificial foods. Okay, so and a lifestyle changes, you have to do regular exercise. Okay, 30 minutes, as I told you, 30 minutes in a day, and 5 days in a week, almost 150 minutes in a week. Okay, if you are doing it, and one point I am telling you, if you are doing it, try to increase the duration of exercise. Okay, and another thing I would like to highlight, people are taking this New Year resolution. Okay, January 1st, what will do? January 1st, January, they will immediately start heavy exercise, gym. Okay, I just advise, I will give you caution to those are having above 40 years. Before going for all the things, at least do visit your doctor whether you are having your heart healthy or not. Okay, and gradually start your exercise. First is your say running, walking, then increase your efficiency. Then you do this exercise, the weight exercises. Okay, not suddenly you decided December 31st you will go 1st January you will do push-ups and weight lifting. So what will happen? Suddenly body will there will get injuries, and also if you are having some problems also heart, there will be exaggerated. So before going for exercise, gym, heavy exercise, especially weight training exercise. So if you are 40 years, more than 40 years, diabetes or hypertension, at least visit your doctor, do a ECG echo, and also possibly a treadmill test. Okay. Another question is, somebody asked, for those with existing heart condition, with what specific precaution can be taken in order to minimize risk of severe heart attacks? Okay. Those are having existing heart disease, suppose heart failure, heart weakness, then suppose you are having this underwent bypass surgery and angioplasty. So what you do is, you have to, beside the routine precaution, your control of sugar, blood pressure, regular diets, you have to, the winter season, you have to take care of also the weather also, because cold weather, if you suddenly expose cold weather, there is a vasospasm, so the blood vessel size will decreases, and you will prone for another heart attack also. And also the respiratory tract infection will also exaggerate the heart failure symptoms, heart attack also. You have better to avoid cold. Okay. And the last question is, somebody, in summary, what are the main reason of severe heart attack in winter? Why is personalized healthcare essential? Imagine these days. Okay. So as we have discussed, the heart attack occurs more in winter, that is the cold weather. We are lucky that in our setup it is not extreme cold, but in Western countries there are extreme cold. Okay, so another thing is they are adapted to that cold weather, but we are not adapted. Our body is not adapted to this cold weather. If you are going in, especially in night, okay, we should wear sufficient protective clothing. It's not that you will not have this problem. Everybody is prone for this problem, because this is physiological change. If body will exposure to cold, there will be vasospasm and the increased platelet aggregation, clot formations. Okay, so especially those are having heart diseases, the old age population, the diabetes, hypertensive, you should take proper care. You should before going cold also. If you have sufficiently, it's better to avoid going cold also. Late night parties, okay, and this rooftop parties, alcohols, cigarettes. It's better to avoid it, because see, your entertainment should not come in cost of your life. Okay, we don't know. You may have the problem, existing problem. You land in problems and in the heart attacks, other problems, respiratory tract infection, heart failure, all the problems also. And other thing is also beside heart attack, all the spectrum of the blood clot formation, the stroke, the aortic dissection, a lot of diseases, they are more common in winter. Okay, so okay, so another questions. Okay. It is a nice question from Dinesh Raju. Hello sir, is the cold weather directly linked to increased risk of heart problem? If so, how does it impact cardiovascular system? Okay, as you discussed, cold weather, what will happen? Suppose your body, as I told you, the body is a mechanism. Means there are a lot of this enzyme changes, a lot of metabolic changes are going on. Enzymes reactions, the CNS function, the blood vessel regulation, all the things, they require a range of normal range, fixed range of temperature. What will happen if the outside is cold? Suppose 20 degree, your body is 37 degrees. So what will that, the heat will dissipate to surrounding. So body, what will tell is the physiological response, by to try to conserve the warmth, means your heatness, so that the normal activity, digestion, all the function will go on. Okay, so what will the, in response to this, there is a vasospasm, when the blood vessel size will decrease. Okay, so that the blood flow to the skin from the center of the your body will decrease. Okay, so as the vasospasm occurs, the hormone will decrease, non-adrenaline, vasopressin, blood pressure will shoot up. Okay, the coronary blood, heart pressure also decreases. It is normal response. Everybody happens with everybody. But those are having previous heart disease, already there is a block in the artery. Further, the artery size, the blood vessel size will decrease. So that will lead to clot formation, all the things. Okay, and cardiovascular diseases, the cardiovascular, including heart attack, sudden cardiac death, aortic dissection, arrhythmias, atrial fibrillation, this all cardiovascular diseases and increases in winter season. Okay. Another question is, what are the common tests that diagnose heart complication? Okay, it is, as you know, the most common test in heart problem is you do ECG. ECG is available everywhere, every center, even if also rural area, ECG is available. Okay, so ECG basic test is ECG, then 2D echo. Okay, 2D will give you idea. Then you will do a troponin test, cardiac biomarker test, troponin. Then if all the things are there is a problem. Now also it WhatsApp, now social media, WhatsApp is there. You can send a ECG report to somebody also, some cardiologist. Okay, if there is a major problem, they can also reciprocate and ECG, echo, and if it is same, if 40 years above you have diabetes, hypertension, you can go for treadmill test. ECG, echo, TMT, treadmill test, and troponin test. If you are having problem, you can go for invasive test like coronary angiography. There is a block, you can go for angioplasty. Then Hemanta Nandi, sir, are there any precaution to take individual with heart condition who plan to travel during winter? Okay, so you know, winter season is a traveling season, fun active season. So you cannot, being a social in a society, you cannot ever travel. But the thing is, if you are having this, if you are young, it is not a problem thing, but if you are in old age, had heart problem, diabetes, hypertension, you are traveling, so you have to have the sufficient clothing, and you have to take the emergency medicine also, diabetes, diabetes, hypertension, take proper medicine. And it is better to avoid travel in night in winter season. It is better to travel in day seasons. Okay. Hello sir, is the cold weather directly linked to increased of heart problem? If so, how does it impact cardiology? As we discussed, it is cold weather. It is not only the coronary physiological response, the hormonal changes occurs also. The adrenaline, normal adrenaline, vasopressin, and the blood level of cholesterol also increases. Okay, in winter season. So the lot of, and other else also like the dietary pattern changes. Another is stress level also increases, loneliness. Okay, lack of sunlight. All the risk factor also the heart attack changes. So the cardiovascular diseases also increases. Dr. Prashad, question really informed, sir. Thank you. Please tell me the audience the importance of TMT test, the heart condition check. So treadmill test is nothing. It is ECG test. Okay, because ECG will take the patient lie down position, and will take ECG. ECG shows only that point of time heart rhythm. Okay, heart condition. But treadmill, you will put ECG. Okay, and you will ask to do exercise. Okay, a graded exercise. You will gradually every 3 minutes you will increase the exercise level. So in the main treadmill test, you will monitor the ECG. If you will give stress to heart, how it is behaving. Okay. So this is the treadmill. Okay. So 3 stages are there: peak stages, recovery stages, and you will see, you will observe whether these changes are there or not. If there is a block, definitely there will be chest pain, and the ECG changes will be there. That is ECG finding ST depression will be there. Okay. So a heart attack occurs only in exertion, most times in exertion. If you give stress, it is a guided stress to heart, and you will monitor the heart condition in ECG. Okay. So treadmill test, if you are having diabetes, hypertension for above 40 years, at least you should go for a cardiac checkup. Okay. At least once in a 2 year, 3 year. If you are not having any risk factor like diabetes, hypertension, above 40. If you are having diabetes, hypertension, at least you should go once in a year, including ECG, echo, including treadmill test. That is called a stress test. Sir, are there specific symptoms heart issue that more prevalent in the colder months? Okay. So heart attack, what happens? It is a nice question. In the colder months, you will like to more like to have more anginal symptoms. Okay. And also more heart attack symptoms, and there is also atypical presentation also, because there is a cold and flu, there will overlap the heart attack symptoms, breathlessness, there will overlap, and sometimes also there is sometimes you may not have some autonomic symptoms are less also in cold weather, and you can present with sudden cardiac arrest also. The risk of cardiac arrest is more, and severity also more. Okay, so this thing. How does alcohol consumption affect the heart? What are the recommendations for heart attack? Actually, cigarette smoking is zero. You should 0% for smoking. Those are not taking alcohol. It should better to avoid taking alcohol, because heart attack, this alcohol not only increases the heart problems, it will increase this also other problems like your liver problem, your social problems, all the things. If you are taking alcohol, you should take moderate, means you should take 2 packs in a week. Okay. If you are still want to take alcohol, but still if you are not taking alcohol, it is not recommended to take alcohol. Although sometimes somebody's observation study says that mild taking alcohol is good for health, but it may or may not good for heart, but it may or may not for good for heart, but it definitely bad for your liver and your also social the things. Okay. Another thing, please suggest how can one differentiate between normal winter fatigue symptoms of a classic cardiac issue. Okay, because this see in winter what will happen? You will have some symptoms because the basal metabolic rate, okay, will decrease. You will feel some symptoms of lethargy, weakness. All the things are there in the winter. But cardiac symptoms, there will be other autonomic symptoms, okay, like palpitation, easy fatigability, and sweating, and if there will be chest pain will be there, and all the things is mostly if you are diabetes and hypertension, old age, if you are having risk factor of cardiac disease, if you are feeling it is for 1 to 2 days, okay, you should better to go visit a doctor and do a ECG, echo, and if possible treadmill test to be done. Are the specific monitoring measure or home check that should be conducted regularly? Okay, specific monitoring measures at home. Okay, see, the winter season, the problem of winter season is besides this your cold weather and this decreased sunlight, all the things, you will get less time during days. Mostly you do activities in days. So daytime will be 10 hours. Okay, sunrise will come at 6, 7 o'clock. So people used to wake up 7, those who wake up in summer 5 to 6 o'clock, they wake up 8 o'clock. Okay, so home monitoring will do, means if you are diabetes, more often you will check your blood sugar and also do blood pressure checking also, okay, in home. Another thing is, in also while sleeping also, we should protective clothings, all the blankets we do use it, and also it's better to avoid home heaters. Okay, excessive heat is also a problem. Okay, then sir, may I know the type of exercise are suitable for maintaining heart health during winter? As I told, in winter you should go for, before heavy exercise, you should go for warm up. Okay, because in winter is a must. You should not go directly heavy exercises. If you are doing exercise for 30 minutes, you should at least warm up your body, like walking, okay, for 10 minutes, so that first your basal metabolic rate let it to increase, let the body to be adaptive to your exercise. Then it is better to do, always it is early morning exercise is good for health. It is seen that if you do exercise 7 to 9, it is better than if you do exercise in the evening. But it is better to avoid outdoor exercises, especially nights. Okay. How frequently should someone undergo cardiovascular screening or checkups? Okay, as I told is, if you are 40 years, even if you don't have symptoms, okay, because see, diabetes, hypertension, they are silent killers. By the time you have symptoms of hypertension, you will already you have blood pressure for last 2 to 3 years, and the sugar will be 300, 400 like that. So it is a natural phenomenon after 40 years, because of your our lifestyle, you are more prone to have diabetes, hypertension after 40 years. So at least once in a 2 3 years, if you are 40 years, you go for this heart checkup, including your sugar test, cholesterol test, blood pressure test. But if you are having diabetes, hypertension, besides this your blood pressure checkup and sugar checkup, at least once in a year you should go for cardiac checkup. ECG, 2D, because this is a simple test, it will not cost more. ECG, echo, and the doctor, if the doctor advises, you can go for treadmill test. Okay. So it is, I hope that you have learned something, and I learned something also, how to take care of your heart, especially in winter season. Okay, thank you.